Beginning today, several Bay Area counties are starting to require masks to be worn once again in healthcare settings. KTVU's Amanda Quintana live in studio where the mandates are beginning here and how they do differ county to county, Amanda.
Yes, so there are 6 counties that are requiring masks, and that all starts today. Now, that's only in medical buildings where patients are being cared for, but there are different rules for different counties, and some are requiring patients to mask up as well as healthcare workers.
I carry one in my purse, it's coming back and I'm not going to chance it.
Esther Gomez doesn't need a mandate to tell her to mask up. She's been wearing hers in public for a few months now.
It's for our own good.
She appreciates the new mask mandates going into effect across the Bay Area today in San Francisco, Alameda, Contra Costa, Santa Clara, San Mateo, and Napa counties. They require masks to be worn in hospitals and skilled nursing facilities, but the requirements vary from county to county, with Santa Clara being the strictest and also including places like private doctors' offices, dental, and even physical therapy offices. Most counties require just healthcare workers to wear masks, but in Santa Clara and San Mateo counties, patients and visitors also have to wear a mask. Dr. Anirudh Kumar Mishra, who has an independent practice in San Francisco, says whether mandates like this are helpful depends on what the goal is.
If you're saying, well, I want to stop COVID, well, I don't think that is going to, that cat's out of the bag. There was no stopping COVID. Everyone was going to be at least exposed to it no matter what we did. So is it practical then to put everyone in an N95 to try to stop something which everyone's already been exposed to? Well, maybe for a very vulnerable population.
He says at the height of the pandemic, the fear was people were asymptomatic, but still carriers. Now, a majority of the population has been vaccinated or sick with COVID, so that concern is less. So forcing someone getting physical therapy on their foot, for example, to wear a mask doesn't make much sense now, but it could help if there's a broader goal.
We saw in 2020, right, that there was a lot more masking going on, and it was the case that other pathogens transmitted less. It was less flu cases as a result. So I do think there's some decreased burden of transmission with masking in general. I don't think it can secure you from COVID, however. That I think only N95 can, from a masking standpoint.
Most of these mandates run through at least the end of March. In Contra Costa County, it's through April, the time deemed the winter respiratory virus period. While the patients we spoke to chose to wear masks already,
I only mainly wear it in the hospital because that's mainly where all the germs is at.
They think others will be irritated by this new rule.
It's going to be a huge shock all over again. Hey, now I got to put a mask on my face.
Now, there are 3 Bay Area counties that do not have a mask mandate. Those are Solano, Sonoma, and Marin counties. Garcia.
All right, we'll see if they do the same. Amanda Quintana, thank you.